Toxic multinodular goiter is a type of goiter, and it is the most common cause of hyperthyroidism. Like Graves' disease being the first one, the toxic multinodular goiter is the second most common cause of hyperthyroidism. And if we compare it with the hypothyroidism, the iodine was the most common cause of hyperthyroidism, but here the toxic multinodular goiter is involved. Now, talking about the toxic multinodular goiter can be there are two types of goiters. There is a non-toxic and a toxic. Now, toxic multinodular goiter can arise from the non-toxic multinodular goiter. That means the goiter that was at first non-toxic, it can change anatomically, it can change functionally to the toxic multinodular goiter. Now, the mechanism through which the goiter changed to the toxic multinodular goiter, it is not known. It is not well known that how basically this conversion or anatomically change occur. But the thing that is known about the toxic multinodular goiter is that there are two things, or there are two. You can say that there are the two phases that are observed in the patient, or there are two kinds of the patient that are observed with the toxic multinodular goiter. One group of patients are those that show that have no effect upon when they are administered with the thyroid hormone. There is no effect on the iodine uptake, and there is no iodine test. You can say that iodine test is not positive, or they're not affected by the thyroid hormone. What happens in this kind of the patient? Basically, what happens that the nodules that are present there, they are not involved in the deposition of the iodine. Iodine is diffused and dispersed and somehow manage its absorption, and then there is the formation of small fibrous nodules that then combines with the other nodules and give rise to the toxic multinodular goiter. Whereas in the second condition, in a second group of the patient, what happens that if the level of the iodine is affected by the administration of the thyroid hormone. Now, in such cases, what happens that the iodine is being deposited in the nodules. When the iodine is deposited in the nodules, what happens that these nodules they combine with one another and gives rise to or increase the size of the nodule increases, and because of the deposition of these iodine, what happens that it suppresses the normal cells. These nodules tend to suppress the normal cells of the thyroid gland and cause the toxic multinodular goiter and the diseased condition. Now, you can say from these 2 points, you can say that this is a nodular disease. In toxic multinodular goiter, the nodules are basically the reason that lead to the abnormal functions of the cells and lead to overproduction of the thyroid hormones in the body. Now, when the normal cells are suppressed, what happens that the hormone that is present in the blood, it is also not able to signal back to the hypothalamus and for the absorption of the iodine or for the production of the thyroid hormone. Rather, the cells that are suppressed, they lead to the sequestration of the iodine. That is another point here in the case of the toxic nodular goiter. Now, talking about the clinical feature of the patient who is suffering from toxic multinodular goiter. Now, the symptoms of such patients are, you can say, less severe, and there is no exophthalmos, that is the protrusion of the eye. That was the most prominent feature in case of hyperthyroidism, and it was a prominent feature in case of the Graves' disease. It is not present here, rarely a case that present with exophthalmos. Then there can be the cardiac complications that we have discussed, can be because of there is a hyperthyroidism, basal metabolic rate is increased. There will be the production of increased production of the RAS and the erythropoietin that will then lead to the cardiac complication by increasing the cardiac output. So that can be symptoms that is related to the hyperthyroidism. And then there is a slight increase in the T3 and T4 level. As I told you, that the cells are suppressed by the nodules, so the level of the T3 and T4 is not much high. So this was all about the toxic multinodular goiter, that is the second most common cause of hyperthyroidism.